fellow nursing students. Thank you for joining me for another video based on information gathered from other nursing students right here at Simpson. In this video, we will cover two of the most popular topics nursing students touched on in our recent student surveys. Topic number 1 is test-taking strategies, and topic 2, outside resources to help you succeed in the program. Now let's get started. Test-taking strategies. Okay, if you feel nervous or anxious before or during exams, you are not alone. The exams in nursing school are uniquely challenging to any exams you had in your prerequisite courses. Here are some things other nursing students have to say to help you succeed. Believe in yourself. Hopefully you've studied the material and you have a great understanding of the main concepts. Remember that you have prepared for this. Read the question carefully and make sure you understand what they're asking. There also may be more than one correct answer, but go with what is the most correct answer. Remember ADPI: assess, diagnose, plan, implement, and evaluate. ADPI is one of your best friends on exams, so when you get a question and you're not sure, try to figure out what they're asking. Are they asking you to assess? Are they asking you to do an intervention and implement something? Remember ADPI. And then, of course, your ABCs: airway, breathing, circulation. If you have a question and there's an ABC listed in it somewhere, that is probably your correct answer. So remember your ABCs. Okay, we have a few more tips from your fellow nursing students. Remember acute before chronic. So we're going to prioritize here and assess our most unstable patient first. So remember the ABCs. Patient safety. We never leave the patient alone if they could harm themselves or someone else, or if they're unstable. Do something. As a nurse, we wouldn't just run and call the doctor first thing. We want to do our assessments first, if we need to take a blood sugar, whatever it is, get our vitals. We want to do something before just calling the doctor. Least invasive interventions before more invasive interventions. And don't change your answers. Your first instinct is usually correct. Along the same lines, no storytelling. This is something I've had to learn the hard way, but leave the assumptions at the door. Don't go down those rabbit holes in your mind and trying to create a story or a scenario to make another answer true. If you don't know for sure, it's probably not the right answer. So that wraps up our helpful test-taking strategies, and now we will move on to resources outside of ATI and your textbooks to help you succeed in the program. All right, so last but not least, the nursing student survey also asked for feedback about what resources other than your textbooks and ATI helped students succeed in class and on exams. So here are some of their responses. While it's great to keep all of these in mind, it's also important to remember to know your own learning style. Are you a visual, audio, kinesthetic? So seeking out specific resources which may work well with your learning style, you'll be able to learn more efficiently this way, and the content will really stick for you. This can be really helpful in solidifying difficult to understand material. So here are some of the responses. Many students said to pay close attention to your course PowerPoints and Quizlet. A lot of students found making flashcards were really helpful so they could study on the go. There are so many online video libraries such as Level Up RN, RegisteredNurse.com, Khan Academy, Mark Klimek, just to name a few. Many students noted that study groups and study guides were very helpful to them as well. Although study guides are an additional cost, they do correlate with your textbook and might be a great resource to help really solidify that difficult to understand material. Upperclassmen are also available to talk to. You can ask them how to prepare or study for a certain class, or how to succeed on exams for that class. And of course, there are tutors on campus for free. So that sums up many of the outside resources nursing students recommended to help you succeed in your courses. I hope you give them a try. And remember, everyone is different, so what works for one student may not work for another. I encourage you to keep trying different methods until you find what is best for you. Thank you, and I wish you all the best on your nursing program journey.